All right, guys, so today we're going to do some SkinVive. We have a young, youthful patient that feels like, being here in Vegas, his skin always dries out, right? So as you know, SkinVive is the first and only microdroplet hyaluronic acid treatment that helps with skin smoothness and, on my end, hydration in the skin layer. As you know, SkinVive raises in the dermal plane the aquaporin 3 as well as glycerol, which is a protein in our skin to help elevate the hydration internal to external. So really what we're doing is triggering the body to tell the hyaluronic acid to uptake water by stimulating the proteins of our skin, which is aquaporin 3 and glycerol, to hydrate from the inside out. So what we do is from nose to ear, we're going to hydrate the cheek zone, and even some of these, fine lines around the mouth to really etch in all the hydration, the smoothness. So what we do is we have Taylor turn. We're going to mark out this grid. This grid is a very consistent way to inject very safe and effective in the even plane that we want to create in that dermal junction. So it's not necessarily filling an area, we're hydrating an area. So that's why we really consider this one of the first and only FDA-approved microdroplet techniques with a hyaluronic acid profile that will hydrate and moisturize the skin. So same on this side, we're going to draw the same grid. And in every little square here, we put just a droplet of product that's going to just hydrate from the inside out. Once again, I get asked a lot of these questions as SkinVive is a hyaluronic acid profile, but is a low molecular weight, low hyaluronic acid profile at 12.5 milligrams that just really triggers those proteins that hydrate from the inside out. So, all right, so we do one syringe each side. We're going to just balance. We start lateral to medial, just really giving a glow and a shine from nose to ear, all in this tissue plane. So like I said, with Taylor, this is a very soft, consistent treatment. I do recommend this doing, roughly about every 6 to 9 months. The first 2 treatments, I always commit my patients to 2 treatments as we're trying to just slowly raise that aquaporin and glycerol to hydrate from the inside out. I do see clinically with our patients as we do 2 good treatments, you're going to only get better and better from the first to the second. So I at least have my patients commit to those 2. And then we just keep it comfortable. I switching the needle out and just injecting into those planes. As Taylor knows, we numbed her for about 15-20 minutes. We always want to make sure we're very comfortable through our injections and always with safety number 1 in mind. The nice thing about these injections, it is a very superficial injection, so it will just kind of go right under that initial skin layer without hitting too much vascular. So bruising is minimal, even though we know it can happen at a low rate. So, all right. As you can see, she hardly bled on us. I'm going to do a couple more low just to finish things up, and then we'll go to the other side. So I also like to etch in any fine lined rhytids. Those are very, very fine lines around the mouth, maybe the radial cheek line. Some people get those little stubborn accordion lines. This is an amazing product that we can etch in those fine lines. As we know, it is an off-label technique, but knowing that it'll hydrate, this is where we can go very, very superficial or shallow on the skin without creating any lumps or bumps to really fine line etch some of those areas. So, all right, smile for me big and relax. She does not have a lot of nasal labial fold lines, but as she wears makeup, sometimes it sits in those little cracks, and we're going to etch all those. So what we do is just a couple here, 1, 2, 3. A lot of patients that want a subtle hydrating look. I think SkinVive is amazing off-label for the lips. We do 1 syringe on the lip, 8 poke injection. It's more of a hydrating, moisturizing technique that works amazing. It's not so much the volume, but the hydration. So it's not necessarily I'm trying to create a look, but a hydrated appearance to the lips. So once again, we'll go to this other side and start doing the same thing. So we're already done with 1 syringe, 1 cheek, less than 2 minutes. How's the comfort, Taylor, if you'd say?
It was very easy. It's really quick, just like how Botox is. It's just really quick.
Absolutely. And
easy.
Once again, obviously Taylor's highly educated in some of these products, but if you guys aren't talking to providers about communication of what the product does, what to expect, the outcomes, the sensitivities that can happen, it's a very important thing you want to do. As you can see, Taylor does get a little red to her skin. This can be a little of the lidocaine, but this does subside within the next hour or 2 as we just poke a few different times to make sure we don't over-irritate that tissue plane. As you can see, light little droplets. We're not really causing even any too much bleeding as we try to eliminate. And we're just going to kind of trace that out. About 6 to 10 pokes, we change that needle. So Joey's a great assistant in the sense of what we're doing to change the needles and make sure each patient is comfortable on the approach. I feel like for all of our staff employees here, we all are highly educated. we have each staff member kind of rotate through what our providers do to make sure we're all highly educated, as well as getting all these treatments. You know, Joey's done SkinVive, he's done all the areas that he will talk to you guys about, just to make sure we are giving you the absolute best expectations. So not only do we believe in these treatments, we actually do these treatments ourselves to make sure you guys understand we only offer the best and we want to give the best. So that is SkinVive. Less than 5 to 10 minutes, we can inject where we can glow and shine the skin to make a smoother, dewier look. Of course, as you know, Vegas can get dry. And when it's cool out, we are always going to be aware that we can dry out without knowing that we're thirsty. The other thing I love to pair with the SkinVive is HA5 as we clean the area. 5 different types of the hyaluronic acid profile that will even give her a better, more hydrated look and appearance to the skin. So there we go. Switch that. We do a little HA5. I do recommend all my patients to jump on HA5 as it is only going to hydrate and give a better look to the skin and the tissue. All right, as you can see, just a little redness. We do a couple dabs of this. I just smooth this out. Remember, this is not a filler volumizer, it's more of a hydrator. As you can see, skin's nice and smooth, besides a little of the irritation or redness. You know, pay maybe 1, 2, 3 out of 10, not too bad. And we do numb for all these treatments themselves. So we'll go to the other side. I do have my patients actually wash their face naturally like they would. I actually want them to distribute that product evenly so it creates just this nice little tenting and hydrating effect in that skin plane to just give a more plumpy, dewy, hydrated look. So